Good morning. I'm Prescott Atkinson. I'm the Chief of Allergy and Immunology at Children's in the Department of Pediatrics at UAB. And I'm very pleased to be here today, particularly because this is the year when the State Health Department is going to begin screening for a condition that they're not screening for yet, which is severe combined immunodeficiency. I take care of children with a whole variety of different types of immune system problems. There are over 200 inherited problems with the immune system, but most of you are familiar with the boy in the bubble, a very famous case of a boy who was born with essentially no immune function, who eventually died as a teenager after a bone marrow transplant back in the late 80s, I believe. And that syndrome, which is called severe combined immunodeficiency, is the very most severe type of immune deficiency. There are about a dozen different genes that can cause this, and we're continually finding new ones. There's only one really definitive treatment, which is bone marrow transplant. So we've been Dr. Fred Goldman, who's the chief of the Stem Cell Transplant Center at Children's, and I have been involved with the newborn screening group here for the past 3 years as they've prepared to get ready for this. And last year, the FDA finally approved a test, and so they're getting ready to begin screening. We know that there's about one baby born every year in the state of Alabama with this severe immune system problem. The babies, like many of the other conditions that the screening that are screened for, they look perfectly healthy at birth, and then they begin to have a syndrome of recurrent infections that get progressively worse, and finally this condition is ultimately fatal, usually by a year of age, if it's not treated with bone marrow transplant. So, and we know that the earlier this transplant takes place, the better their chances are. So if we can get them before 3 months of age, they have better than 95% chance of doing well after transplant. If we get them after that time, because of the accumulation of different types of viruses and bacteria in their system, and because many times they come in gravely ill, their chances of doing well with transplant go way down. Less than about 2/3 of them survive after bone marrow transplant if they're transplanted after 3 months of age, and many of those children unfortunately have severe disabilities because of the severity of the infections that they've had. So we're very hopeful that this new screening process is going to shortcut that process. It is, although there's only one, we expect only about one per year. There are actually a number of other conditions, immunologic conditions, that are going to be picked up. We know from the experience of other states that are doing this, that have low T cells, and those can be variable. Some of them can be quite serious medical conditions. So there will be additional benefits from this screening process. And I want to introduce to you Melanie Self, who I first met in 1998 with her son Adam, was transferred from an outside hospital to Children's. And this is the typical situation. Without a newborn screening, we are usually not the people that are seeing the babies. They come into the ICU, they're coming into the ward service with some serious infection, and someone happens to check their lymphocyte count or check their immunoglobulins and realize they have no immune function. And so then we get consulted, and usually it's late, and it's often a desperate battle. And the parents have a really difficult odyssey to go through before they can hopefully thread the needle and get a successful transplant. And Melanie is going to tell you about her odyssey, and we hope that we're going to be not seeing so many of these in the near future. Thank you for coming up.
Hi. My name is Melanie Self, and I'm from Spanish Fort, Alabama. We're just across the bay from Mobile, and it's a very tiny town. I have to put my glasses on because I can't see. My story began on April 7th, 1998, when I was blessed with a 7-pound, 13.5-ounce baby boy named Adam. My pregnancy was normal, and to all appearances, nothing was wrong with Adam. He was healthy and strong. He grew, he ate, he thrived for 8 weeks. At 8 weeks old, I was still breastfeeding, and Adam started projectile vomiting, And I don't mean just spitting up. I mean it was going across the room. And of course, that sent up red flags. The pediatrician took him off breast milk and immediately tried another formula to see if it would be better for his stomach and see if he could hold it down. Adam continued losing weight. They continued changing formulas. Nothing worked. He finally dropped down to his birth weight, and that's when we were first admitted into the hospital. The doctor that came in and looked at Adam looked at us and said, "Do y'all not feed your child?" She accused us of not feeding our child because he had lost so much weight and he was so emaciated looking. Adam was eventually diagnosed with failure to thrive, which is one of the symptoms of SCID, which we didn't know at the time. Eventually, an NG tube was placed. We were sent to a GI doctor, and they were just trying to get some weight back on him. And during one of his hospital stays, he contracted RSV. That was the pivotal moment in our child's health. We went through tube feedings where we were taught how to place the NG tube when Adam would pull it out in the middle of the night, which we did many times. We had a nurse come to our home every day to do other things. He was still losing weight. It wasn't working. We were doing breathing treatments. That wasn't working. We figured it up. Adam was in the hospital about 7.5 months of his first year of life, off and on. He was given IV antibiotics, breathing treatments. At one point, while we were at Women's and Children's at USA, his body just wore out. He couldn't breathe. He was struggling to breathe. He was dying, literally. They immediately put him in the PICU and intubated him to give his body some rest. At that time, the pulmonologist that we were seeing came in and told us Adam would need one of his lungs removed. And of course, you know, as one of the other parents said, you're the mother's gut instinct. Well, I had red flags going up everywhere. And I told my husband and I talked about it, and we said, you know, something's not right. And the surgeon just happened to walk in, and he said, look, he said, I can't do the surgery. He said, I don't know what is good lung and what is bad. He said, I'm not going to do it. And the doctor came back and he said, well, I can find a surgeon that will do it. And so at that point, we asked for a second opinion. And they gave us a choice to either go to Tulane or UAB Children's, and we chose Children's. So they life flighted Adam up there, and it was quite a few weeks, and the doctors came in and finally said, we don't know what's wrong with your child. And at that point, they pulled in an immunologist, and thank God for Dr. Atkinson, and he did some immune studies on him. And he came to tell us one night, I was there by myself, and he said, I know what's wrong with your son. And I said, well, what is it? And he said, your son has no immune system. And I said, okay, so what does that mean? And he said, your son is going to die if he doesn't get a bone marrow transplant. And of course, you're standing there and you're thinking, okay, this is not real, this is a dream. And I'm thinking, okay, now what? It took us 2 weeks to get insurance in place where he could be life flighted to Duke University Medical Center, where Dr. Rebecca Buckley would do his bone marrow transplant. Once we arrived at Duke, they tested me, they tested my mom, my aunt, and my sisters to see if this was hereditary. And there was no family history of it whatsoever. Adam had his bone marrow transplant on November 5th, 1998. And if you look, I don't know, they have the pictures up. There's a picture. We spent 4+ months at Duke. Adam was still sick. He had to be under the ribavirin tent every other night. He still had the RSV and other things. The picture of the snowman was our first Christmas. We were living in the hospital at Duke for over 4 months. He had a lot of his first there. We were finally allowed to go back to Children's in Birmingham, where we stayed for 2 more weeks, and then we were allowed to come home. Adam had to stay in isolation at home until he was 3 years old. So he and I went nowhere. Nobody could come in. I have a daughter that is 2.5 years older than Adam, and when she would go to preschool, when she would come home, we would have to strip her down and leave her clothes outside because we were afraid that she would bring something in that he would catch. My husband had to do the same thing when he would go to work. He had to strip down before he could come back in the house because we were so afraid that Adam was going to catch something. When Adam turned 5, we were finally told we could take him out and that he could go to preschool. Of course, I went in and educated his teacher about the precautions that would need to be made. So he went 1 day a week. And then at 6, and there's a picture over there, the top left, that's his first day of kindergarten, which was a huge milestone for us because we were told he probably wouldn't live to that. So very grateful for that. I started going into the school every year, and I would meet with the teachers, I would meet with the nurse, the principal, all the staff to educate them on SCID. Adam's SCID happens to be X-linked, which means it came from me. Until Adam is a senior this year in high school, and this is the first year that I have not gone in and talked to his teachers or not sent a letter out to the parents telling them about him. You'd be surprised at the people when they hear that it's an immune deficiency and that think that he has AIDS. We have fought that for 17 years now, trying to educate people that this is not AIDS. Adam is not a risk to you. You are a risk to him. And so, you know, we educated everybody that we came in contact with about that. Our journey is not over. Adam, he has good T cell function, but he has no B cell function. He continues to get subcutaneous IG infusions weekly. He will be doing that the rest of his life. And that's okay. It's a small price to pay. We also found out when I was tested, they told me at NIH that it was a new mutation and that it occurred at conception. So my daughter, who is 2.5 years older than Adam, we thought, well, there's no way she could be a carrier. But we had her tested anyway when she turned 17, and she is a carrier. And they said this is like 1 in a million chance that this could happen, but it happened to us. So our journey continues. When Aubrey decides to have kids, she'll be 20 on Sunday, and she knows all about it. She knows the precautions. She knows her risks. Our journey will continue through her and through Adam because both, you know, their kids have a chance of having the same thing. One little thing, and I know the nurses and the doctors, you know, you have so many people that you take care of, and it's really hard to get a personal, to have a personal relationship with the people that come through. You treat so many. But the pain that we went through that whole first year of his life, when Adam and I lived at Duke for 4.5 months, my daughter was at home with my husband. He had to work. So they were in Spanish Fort, and we were at Duke University Medical Center in Durham, North Carolina. And Aubrey would call me on the phone, and she'd go, Mommy, when are you coming home? So this emotional roller coaster that you're on, the psychological impact of this disease, it's overwhelming. And like someone else said, the guilt, because I know it came through me, it came from me because it's X-linked. So, you know, the guilt can be overwhelming too. But, you know, we have incorporated SCID into our life. This is who we are, this is what we are. And our journey will continue through both of my kids. I am just so thankful that we have added it to the newborn screening panel. One other thing I wanted to say, when we were at Duke, there were 6 SCID kids up there at the time, inpatient. 3 of them died while we were there. So it's, you know, early diagnosis is critical. We were very lucky. God placed us where we needed to be when we needed to be there. So thank you again. And when you come across an immune deficient patient, a SCID patient, think about the roller coaster that they're on, the ups and downs and the highs and the lows, and you know, try to form a relationship with them and understand them instead of them just being another patient that you have. Thank you for your time.